Hi, I'm Deb Flashenberg. I'm the founder and director of the Prenatal Yoga Center. I'm also a labor support doula and a certified lamaze teacher and a mother of two. So I want to talk a little bit about vaginal exams. All right, first let's just start and talk about what are vaginal exams. So vaginal exams done by your care provider are to measure dilation of the cervix as well as the station of the baby. So the station of the baby is the baby's head in relation to the ischial spines. Ischial spines are protrusions on the pelvis, in the inner part of the pelvis, and that can tell where the baby's head is. All right, so that is what a vaginal exam is. Now let's talk about when it's appropriate to get them. So my whole idea about a procedure is the procedure going to give the care provider useful information as to what to do next? So my thought on vaginal exams during pregnancy, I'm actually really not a fan of them for a few reasons. One, so say a mom gets a vaginal exam and she's 1 centimeter dilated. First, that can lead to either anxiety because that baby could be coming soon in her mind, or disappointment, I'm only 1 centimeter. However, finding that out is not going to tell the woman when she's going into labor. So the information that the care provider gathered is really not going to say how the next steps of care should be. Also, so I'm going to give one little story. Years ago, I was the doula to this wonderful woman, Callie, and I was her doula for her second and her third birth. And at 37 weeks, her care provider did an internal and said, "You're 3 centimeters, you're going to go any moment." So here we were, all of us kind of on high alert. I had my phone next to me all the time. Even when I went swimming, I had in a plastic bag ready to go in case she went into labor. And we went all the way to 41 weeks and 6 days. And she was actually due to be induced the next day when she started to go into labor on her own. So gathering that information during pregnancy is not an indication as to when labor starts. So that is why I'm not a fan of vaginal exams during pregnancy, besides the fact they're pretty uncomfortable. All right, so let's talk about during labor. So for moms that are delivering in a hospital, and considering 98% of women birthing are in hospitals, this is going to pertain to most of you guys. So when you enter the hospital, they're going to want to do a vaginal exam just to get a baseline to see where you are. Because if you are 9 centimeters, they want to admit you immediately, although just from your actions and how you're sounding and moving, they can tell if you're 9 centimeters compared to 2. And if you're 2 centimeters, they're likely going to say, you're not that far along, you're kind of in the early stages of labor, why don't you just take a walk and come back in a few hours? So they need a baseline. Now, once things are moving along, I'm not a huge fan of doing routine vaginal exams for a few reasons. One, if the mom's really kind of in her zone, it's going to take her out of her focus and her labor land and her place. I've only a few times seen doctors work with the mom and do a vaginal exam while the mom is in a different position than on her back. I remember this one fantastic doctor kind of went from behind. The mom was leaning over the bed, swaying her hips. She was standing up as an unmedicated birth, and the doctors kind of worked with the mom to find out where she was. And I think that's because the mom was really showing signs of moving through transition. I think the doctor wanted to see where things were going. But most of the time, they make mom stop her labor pattern, get on her back, get on the bed, and open up to do this exam. And again, it takes her out of her zone. And besides the fact, again, vaginal exams during labor are really not so comfortable. Also, if the water breaks, I recommend doing as few as possible. Now, some care providers, once the water breaks, will want to do a vaginal exam to make sure there's no, you don't have a situation of cord prolapse. That's when the cord is coming through the cervix and the baby's head can compress that. Now, that's a dangerous situation. But some care providers do that, some don't. But once the bag of water breaks, you can think of the bag of water as a protective layer with the baby. And once the bag of water breaks, we don't want to have a lot of vaginal exams because we don't want to introduce infection, and that's going to be shown by a sign of fever. I also recommend trying to have the same care provider but the same care provider checking you, because it's not like they're going up there with a protractor. Each person's subjective with how they're measuring, so you don't want to have one person measuring and be like, "Oh, I think you're 5," and then another person be like, "Nope, you're only 2." So it's best to have the same person measure. All right, another time that I think is appropriate to have a vaginal exam would be if the mom is going to ask for pain medication. Now, I've had some moms that say, when I'm their doula, if I find out I'm 9 centimeters and I'm asking for medication, please try to help me go further. So I think it's helpful for the mom to find out where she is so she can best determine if she wants to forego pain medication or if she's ready to take it. So that's a personal choice the mom needs to make, but it's good to have that information. Also, unmedicated births, when it's time to push, you're going to kind of make these pushy sounds and just kind of feel that urge to push. It's called the fetal ejection reaction or the Ferguson reflex. Now, medicated births are not going to have that same reaction because they just don't have that sensation. Now, sometimes the care provider is going to allow the mom to just labor down. So that means that the uterus is still working, it's still contracting and continuously pushing the baby down without the mom making effort. So basically what's happening during this is the uterus continues to contract and it's pulling up around the baby. And as labor continues, the fundus, the top of the uterus, is getting stronger and thicker, and it's pushing the baby further down. And that's going to help the baby continuously move through the pelvis, through the outlet of the pelvis, and closer to the perineum. Now, I remember one birth I did as a doula, the mom had decided to have an epidural, and she took a nap, and then she woke up, and we're all just chatting. You know, she was relaxed, we kept it really easy, and then all of a sudden she said, I think I feel a head. And she was right. I lifted the covers and looked, and you could start to see a little bit of hair. And we're like, okay, let's get the care provider. So that was an example where we didn't need to have her checked. The doctor didn't have to say, oh, you're 10 centimeters, let's start pushing. Her body continued to push that baby down as she was getting the pain relief. So sometimes when you're medicated, you will need to have a care provider tell you when you're fully dilated, and if the head is low enough, start to push. Now, there are definitely some reasons not to have a vaginal exam. Just because there's a change of shift. So say you're in a practice and there's several different doctors, and the doctor you've been seeing finishes a 12-hour shift or 24-hour shift and someone else is coming on. Just because there's a new care provider doesn't mean they need to go up. They can take a look at the notes and get a sense of where things are at. The same goes with perhaps hospital protocol. Some hospitals may say every 4 hours we want to see where you are, and if you're not progressing, we're going to start to do labor augmentation. You don't have to agree to that. I also recommend for women who unfortunately suffered from any sort of sexual abuse, having vaginal exams can be very challenging, very emotionally challenging, very physically challenging. So if that is you, I do recommend trying to have as few as possible. And keep in mind that a woman can say no. She does not want to have the vaginal exams. Looking back now as well, if a woman is unmedicated, a care provider that spends time with the woman and watches how she moves, how she sounds, what her body wants to do, that's going to give an indication as to where the mom is in her labor. So a woman in early labor is going to have different emotional signposts as a woman in transition. And that's going to give a sense. If a woman is saying, I'm feeling like I have to push, or is vomiting or shaking or starting to get hopeless or just heavily breathing, those are signs of transition, which means that the cervix is somewhere between 8 and 10 centimeters. My own personal experience with my second birth, I never had a single vaginal exam. I remember saying, I feel something's coming out. It was actually the bag of water bulging out, and all of a sudden everyone looked, and soon there the bag of water broke, and within 6 minutes my baby was born. And she never once had to say, are you ready to push? My body just started to go there on its own. So that's kind of my idea of when it's appropriate or not appropriate to have vaginal exams. So those moms that are pregnant or thinking of becoming pregnant, just stick that in your pocket for when you're facing that. Or I even recommend talking to your care provider ahead of time to find out when that care provider routinely does these. And if you have some different ideas, just say, these are my thoughts. What do you think? So I hope you have a wonderful night. Happy birthing. Namaste.